a broad eye view, bird's eye view of what is happening in the sector beyond the organizations that we work with. Welcome, Shireen. Janet, just to start with you, in your article, and you can tell the listeners what this article is about, you spoke about 6 lessons of leadership. You actually spoke about, you highlighted the deficiencies that we saw in the leadership within the government sector. But you also pointed out that we're spending a lot of time talking about leadership in the political space and very little time introspecting on what it has taken for leaders in the civil society to step up to the challenge. And you noted in your reflections 6 lessons that you say you hope to take into the future. Do you mind sharing those lessons with us? Yes. I've got one other question for you is, when I was reading your article, it presented a lot of hope and ideas about going forward. But there was a language that you also used there, which made me wonder why the choice of those words. You talked about what it takes to prepare leadership in the civil society space for doomsday. What did you mean by that?
Thank you very much, Masego, for those questions. And once again, for the opportunity for me to unpack the lessons that I've learned through the COVID-19 pandemic. And like you've rightly put it, civil society organizations, where we're sitting and where we are working, we have been working with governments and being very critical around governmental leadership in the political space. But we haven't had enough time to really reflect on our own leadership. This is in general terms when everything is normal, but worse off in crisis. So I was looking at the issue of leadership from a crisis context, where the context presents bad weather for us to be able to carry out our work the normal way and the usual way that we normally do our work. And we also had an opportunity because for this side of the globe, we had the opportunity to learn in terms of responses and civic engagement and leadership. Because the pandemic did not start from here, it started up north and in other continents. So we also had an opportunity to see how leadership was unfolding in terms of responding to COVID-19. So what really then intrigued me was the fact that there were different levels of leadership that were exhibited in the political space. And I was looking at our own context, and particularly the context of Zimbabwe, which is very difficult in terms of when we look at our leadership response, leadership engagement with citizens, and also the work that we've been doing over the years in terms of trying to engage with the politicians. So I really started making my preparations to say when the day comes, which is the doomsday, because I've seen that the responses were showing that there's going to be lockdown, we're going to be in the social distancing that they were talking about. But this was going to be a new way of doing things, and it was going to make our own work become kind of redundant in terms of the approaches, because we're not going to be able to meet with our communities, with the stakeholders that we meet with. The conventional ways of organizing were going to become redundant or useless in a way, if I can put it that way. And for me, that was the doomsday, because we were going to find, if we had not prepared, we're going to find ourselves flat-footed and not be able to remain holding accountable the solution holders. And my biggest fear was as well that the pandemic was not going to be the major cause for concern in terms of killing people, but leadership killing people, if we had not occupied the space to see where the resources were being allocated to tracking the civic engagement, the human rights issues, because we had already started seeing in some places the weaponization of the COVID-19 measures, for example, like lockdowns. So there was need to prepare for that because it was going to be difficult with lockdown and social distancing, trying to decongest. But the issue is there was supposed to be a definition that the work is essential to remain in the space, to defend livelihoods, and also to defend human rights and dignity within the crisis that we were facing. So the doomsday plan was one of the key issues that I learned. Of course, remaining calm and reading the context and the environment was key. But it also meant then that you have to define the role that you're going to play when then the crisis or the pandemic really strike, and answer to the why question. You would need to remain in the space as a leader. So the second lesson was then on the issue of heavy lifting. So the doomsday plan was really key and critical to avoid being found flat-footed. What I realized, Masego, was that when then the lockdowns started being implemented, civil society organizations were literally immobilized, most of them. They could not move, they didn't know what to do. And with that immobilization, it also meant then the citizens that we had been working with were going to be demobilized and be scattered and not be able to then continue to engage. So a lot of then heavy lifting had to take place. And with the heavy lifting lesson for me, it was about then the preparations to be put in place. That's the communication with the different stakeholders, including the communities where we work in, to allow them to be able to know that they may have to take up the spaces where we are not going to be able to reach them. They will have to be standing in the gap and ensuring that they're holding the political leaders accountable. It was also about allaying the fears, because it brought with it a lot of uncertainties. So we had to assure the team, we had to assure the stakeholders that work will continue, and safeguarding principles will also have to be observed in terms of ensuring that there is no transmission as we protected lives, but also livelihoods. I've spoken about the issue of immobilization that came with COVID-19 measures. But what the lesson that I also picked from there was the need for being agile, the agility to be able to seamlessly adapt to new ways of working. And for me, this meant that we had to, in the doomsday plan, we had to plan on disposing usual approaches, which meant that there was an embracing then of new ways of working that we had to prepare for. And the biggest platform that was going to be available within the context of lockdowns and social distancing was the digital advocacy. So it was preparation then, and in the doomsday plan, it was also very clear, how are we going to roll out the digital advocacy so that it can save the day, it can sustain conversations between citizens and the duty bearers that were also going to find themselves in lockdown. For example, Parliament playing its representation role became very difficult. For Zimbabwe, they totally locked down and went home, and they said they could not actually engage. So there was that big gap, and we had to prepare for the digital advocacy and campaigns around that. And when we look, for example, I'll give once again the example of Zimbabwe. We had to start talking to Parliament. You have tablets that you demanded when you came into Parliament. You are going to have to make use of them, ensure that you play the oversight role. So we ran a campaign to say, where are the tablets? Use the tablets to engage. So it was quite exciting and offered opportunities for the duty bearers, the solution holders, to continue to engage. You have spoken about the best.
So, I'm going to ask you to pause there. I'll come back to you, because I'd like to hear more about more from the different lessons that you highlighted. You talked about 6 of them, but I'd like to bring Shireen in at this point, because again, Shireen has a broad view, having worked with and already working directly with a number of civil society organizations. What did you observe just in terms of how leadership showed up, and the differences in how people were able to quickly adapt to the changed circumstances and make sure that we still continued to deliver on our mandate in the respective spaces that we work in?
Thanks, Masego. So I think, I mean, a lot of what Janet has said resonated, because I think we also saw a lot of that in South Africa, although I don't know if our parliamentarians have iPads and are misbehaving with their iPads. But from my seeing, and I'm talking specifically, for example, where I served on boards and where I work with clients in the space, I have the one thing that I did see was that most of the organizations adapted internally. So they were able to, decide they were going to work remotely. They were able to set up their staff with the necessary equipment and access to resources and so on. And I think that went fairly smoothly. And I think it's also led to, in some ways, many organizations deciding they're no longer going to have office space, or they're going to have limited office space in the future, because it was an experiment, a forced experiment in a way that really opened civil society's eyes to new ways of working and using technology to do that. And in that way, being able to give space to recognizing employees, not having to micromanage employees, for example, of having employees be at a desk all day long and so on. I mean, that obviously had other implications as well. And I think specifically for women, the burden of unpaid labor that we often have at home has had an impact on women who have had to take responsibility for those things, even with their jobs. And I have seen that some organizations have been fairly unrealistic in accommodating that. And because employees are seen to be working from home, the assumption is you have a lot of time, and therefore, you can do whatever needs to be done at any hour of the day. So we've seen some of that happen. Externally, I have seen that some organizations have been really good in responding and adapting. And that in different ways, that has been one, for example, engaging with donors. So proactively engaging with donors to say, well, there's a crisis situation here. How do we move forward now? We don't have money to deal with the situation. Can we use some of our money to support our staff? Can we use some of our money to provide emergency funding to our partners and so on? And so that has been fairly, I think, and that was donors were fairly open to that. And I think donors appreciated being called on to say, how are you responding and supporting us now in this crisis moment? The other parts are, I think where there were challenges, for example, was with implementation of programs at a community ground level. And that's where a lot of the issues still are, because we know that we work in communities who don't have access to technology, who don't have access to resources. And in fact, what has happened with COVID-19, it's created more suffering for our communities and less resources available to address that suffering. And I think I do want to challenge this notion of, what has civil society done versus government, for example, because I think government is equipped with the resources to be able to respond in a crisis. Yet in many countries, we have seen governments have left it to civil society to respond and act in this crisis. Most often with civil society not having the resources to do that. And the one key thing that I picked up was that a lot of the community organizations or partners that civil society works with were in crisis in terms of things like food, emergency access to medication, for example, people living with HIV and so on. And it has fallen upon civil society to, for example, respond in those scenarios and come up with creative means. And I found that some of the organizations have really taken that on, where you have found that globally, some organizations have initiated things like delivery services to collect HIV medication and drop it. They've initiated voucher services to give people money, to be able to buy food, because a lot of the people who have health conditions, if they don't have access to food and so on, have not been able to do anything. So those are some of the things that I have noticed.
Thanks for that, Shireen. I think it really does take us where Janet left us off. And Janet, you were talking about, you talked about demonstrating agility and how civil society shifted their advocacy work to digital advocacy, right? But in your article, you also talk about the differences. I think a lot of civil society organizations, particularly in the development sector and in the governance sector, had to adapt. They don't have the tools that lend themselves easily to humanitarian organizations and are able to drop off food packages in the way that Shireen was speaking about. Can you just take us through, unpack what you mean by demonstrating agility? In what way did an organization like yours demonstrate its relevance without having the tools, the technology, and the know-how of responding as a humanitarian organization and having disaster management and response policies in place?
Thank you very much, Masego, for that question. So in terms of agility and being able to quickly adapt, it came definitely from planning, but also it proved that leadership has to be community-driven and citizen-driven, as you have also highlighted earlier on, and also in the article as well. I think this is one of those key issues, and I think the root has to be in the communities and in the citizens, and in terms of then being able to own the spaces that remained open in terms of engaging with leadership. So transitioning from the conventional ways of gathering people, of engaging people, to the digital advocacy meant that there was need to tool the communities. There was tooling and skilling that had to take place between the civil society organizations themselves, and I'll give ZIMCCOD, for example. We had to give the tools of trade to the community leaders that we had identified that we're going to carry on with the activities. So this included the issue of data. This was to also ensure that there will be some level of connectivity with the communities, though of course some spaces that would have otherwise reached out to physically it was not going to be possible because connectivity also left out some, but at least we had to identify the critical communities and the critical mass for us to continue with the digital advocacy and tool those and skill them to be able to know. So how does Zoom work? How does Teams work? Where are the platforms that we are actually going to be able to use? So calibration, I would want to use the word calibration in terms of identifying and saying, okay, our digital advocacy is going to be driven from home. Who has the tools to be able to do that? What are the topics that we are going to maintain and sustain even when we are operating from our homes? What are the social media platforms, for example, where we are going to find most of the people? And would realize that, yes, there are quite a number of people on Twitter, there are quite a number of people on Facebook, but we had to quickly open different WhatsApp groups, for example, because we thought that most communities that are actually vulnerable use WhatsApp because it's easier and it's cheaper. There are data bundles for that that are cheaper to be able to use. So it was also to identify those spaces so that there was seamlessness in terms of then shifting to the digital advocacy spaces.
Yeah. So it sounds like you were able to continue doing the work. I
Yes.
want to get to what kinds of skills are required in this instance to, one, keep a team that does very important work inspired and motivated and still showing up to do the work. Shireen spoke about how this remote working, yes, it's a new way of working, but what it does is it shifts the burden, particularly on women. It does just put in an additional burden in a space where you're already doing the care work, and you must now also, do the digital advocacy and demand of parliamentarians to do this, to do that. what was the approach that you used to keep your team inspired and motivated in this time? And then I'd love to hear from Shireen to also share examples of what leaders in the civil society space did to keep their teams motivated and inspired to continue delivering the important work. It's quite taxing.
It is, it is, and it also comes with its own challenges. Masego, there were a lot of hurdles to also go over and to jump over in terms of coordinating even the team in the different spaces that they were in, and to ensure that we also kept on getting the results. So for my institution, we had to sit before, we actually went on our own lockdown way before the government then announced the lockdown for Zimbabwe. It was then 30 March, but we went on lockdown. By 16 March, we were already operating from home. And because we had already put in place our plan, the doomsday plan, but we had also put in place a teleworking policy. So the teleworking policy then contained quite a number of issues in terms of how are we going to work, how are we spaces where we're going to convene online as staff and motivate each other and find out how we're doing and our families, and then also check in terms of our results and our deliverables, and also share ideas. And I think I just have the privilege of having what I would want to term the entrepreneurial leadership. That I think is very key and important in the NGO sector, and we haven't really nurtured this and amplified the need for entrepreneurial leadership in the NGO sector and in the civil society sector, to be specific, in terms of then trying to ensure that, you know, an entrepreneur never wastes a crisis. So the motivation came from the point that never waste a crisis. There are opportunities in a crisis, and entrepreneurs, they jump into the crisis and become creative and provide solutions. So I think that is the kind of motivation that I have with my team, that we are entrepreneurs in the civil society organizations, and entrepreneurs have to bring in ideas, they have to be creative, they never have to waste.
I think that's such a good point.
That was the big issue for me. So it kind of then allowed everyone to be able to adapt, to bring in their own idea in terms of how we're going to work, set their own deliverables, to say these are my posts. So we had a dashboard which you called my post-COVID results. So we said, when all this is over and done, each and every one of us has to have their dashboard where they would say, this is what I managed to do to ensure that I kept my community connected, I kept the citizens connected and involved, even in a crisis. So the dashboard would come in, the My Post-COVID dashboard continued to be populated with different results and what we were doing. So it was really about entrepreneurship. And I think when there is that spirit of entrepreneurship in the civil society organizations, it is possible to keep people engaged and motivated to achieve on their own. I think that was one of the key issues for me that kept us going, and that made us be one of the organizations that remained very visible and actually became quite active during the crisis, instead of finding ourselves flat-footed.
Right. Thank you so much for that, Janet. Shireen, what insights would you like to share with us on the same question?
Yeah, just in terms of what Janet said, I think I want to pick up on this entrepreneurship idea, because I think civil society and nonprofit organizations in particular are facing a situation where they have to think differently about their long-term existence. And for me, COVID has really opened the door for them to see new ways of being. And the entrepreneurship, the social entrepreneurship way of existing is almost something that may be inevitable. And if nonprofits don't consider that in terms of their long-term sustainability, you know, they can possibly forget about surviving beyond the next 5 to 10 years. So some of the things that I want to add to what Janet has said around how they have adapted is that what I've seen with some of the leaders in the sector and on the boards where I sit, there were a couple of things. So the one was that I think the key quality that I saw in the leaders that were doing well were ones who were open and who were accepting of the fact that they can't solve this alone. So they needed to collaborate with others in order to move forward. They needed to lean on their team to be able to move forward. They needed to bring, the different resources in the organization together and to kind of move out of the box of thinking that, this is your job, that is your job. What COVID created was that people showed up with skills that were often ignored in the organization or not noticed. And good leaders were able to take on those skills and use it in different ways in the organization. So that's some of what I saw. Then the other is there was a strategic capability that I picked up in some of the leaders, which was around forecasting what was going to happen. So what are the scenarios that we are faced with, and how are we possibly going to have to respond to that? And one leader in particular, I don't even know if it was June or July, and we had a set of 3 scenarios where it was saying, if this happens, the organization is going to be affected in this way, and we'll have to do that, and the other. And as well as how prepared the organization is and what steps the organization is taking to prepare itself for these scenarios. And I found that truly amazing, because now the organization I see is stable. It's in a position where everybody knows what they need to do. Resource mobilization is happening as it should. So, it really helped the organization and the board from a strategic point of view to be able to think forward and not be stuck in the moment of crisis. The other thing that I saw was around what Janet said about seeing this as an opportunity. I think for some leaders who are risk takers, who thrive on challenging opportunities, they saw this as an opportunity to show themselves, to be able to act, to be able to show their boards that they can do different things, that there are different ways of doing, where in the past they may have struggled to convince the board to do something. Here they had an opportunity to say, but look, we can do this, we're in a position to do this, we have the capacity, or whatever the case may be. And then the other thing that I saw was that there was the leader recognized the need for the organization to provide emergency support to its community. So it was not, no, we have to follow our work plan, we have to do this, we must implement this, that, and the other, but it's what is the situation creating now for our community, and how do we respond, and how do we get the resources to respond? And I found that quite a few organizations were able to do that. Of the ones that I know, they were able to mobilize their donors and provide the kind of emergency response that you would ordinarily not see happening. So for example, I sit on the board of an LGBTI organization, and they were able to mobilize resources to support individuals in the LGBTI community who have been struggling, who were put out of their homes, who were not able to access, food and things like that. And they were able to give individual grants, which ordinarily donors would frown upon, but in this case were really open to. And the other organization started a major food delivery scheme for the children in the different communities where they work, because children are their core group of beneficiaries. And so I think that there has been great leadership shown in the civil society from what I have seen. There have been cases where people have felt a bit overwhelmed, and I think that's normal. We all felt overwhelmed at times, and some of us ate too much chocolate and drank too much cool drink, and now we have to live with the effect of that. But I think that, people really did the best that they could. The ones that I think will continue to struggle are the ones that kind of were totally overwhelmed and were not able to do anything, and kind of felt that it was others' responsibility to save them. Those are the organizations that I can guarantee you are not going to survive. If you have a leader that was waiting for someone to save them, then that organization is not going to make it.
Right. Thank you, Shireen. I think that such powerful insights. And I'd like to invite our participants to also post any questions that you might have for Shireen and Janet. I'm sure there's lots of questions that you really have out there. that would enrich the discussion. One of the things you said, there's a lot that you said that I really like, Shireen, which resonates, and a lot of what Janet herself said earlier. But there's something that you said about this moment has meant that we have to learn new ways of being. And I think that one important factor of learning new ways of being and bringing that lesson into organizations is the issue is an issue of self-care. In the feminist space and organizations, that women's rights organizations, this is at the center of how the DNA of institutions. But we can't say the same of development organizations. Janet, just shifting from what needed to be done to how it needed to be done, can you just take us into your confidence about what the notion of self-care meant for you as a leader and what it meant for your team and the community around you? How did that play out?
Yeah, thank you very much for that. And we continue to talk about self-care. But one of the key challenges I think that I saw is that we were in isolation, and it meant a lot of mental stress and burnout as well, because we were working in the new normal, but we were not so sure of, and we were chattering into waters that we had never been into, and the issue of self-care was very, very important. And there was also the burden, like Shireen indicated, at home as well, for mothers, for example, with the homeschooling, and just being with all the kids in one place and work as well was quite overwhelming, and finding that balance as well of working from home and then separating that this is now work and I'm now attending to the home issues that I have to attend to was a big task. And being conscious of that need for balance is, I think, one of the key steps of the life-work balance, is one of the key steps towards the issue of self-care. So there is need to then put the boundary in place in terms of the times that you're going to work, the deliverables that we were working on, deliverables mainly, and results, like I've indicated. So time management was solely dependent on the person themselves. So it meant that you could then have time for your own self-care. And in our check-ins, our weekly check-ins as well, for staff and also for our families, it was to give each other, time to just vent and talk about the situation at home, the fears. If anyone already had a relative maybe who was already infected, and one of the statistics in terms of the infection. So we were giving each other at least time for us to download in terms of the pressures that we had. So one of the key questions that each and every one of us had to ask is, how are you doing from wherever you are? So people could really talk and help each other in terms of how they were coping and managing, but also the fact that maybe some were even scared some were running out of food, for example, the food stocks that we had. So we also had to find out, do you still have stocks? The one who doesn't have vegetables, how do we ensure that they get to them, for example, so that we each felt cared for within our organization and within our institution, despite the fact that we were not seeing each other. And there were no spas for massages or for coffee or for tea for us to go to. So it meant that our platforms, we also had to use our own platforms just for the catch-up as well, and ensure that we are catered for. So the issue of work-life balance was really a key issue, and burnout actually increased. So we also had to, because, with the virtual platforms, you can go on and on. We were organizing different communities in terms of sharing the resource tracking. For ZIMCCOD, we quickly launched the COVID-19 resource tracker, where we were tracking resources that were being pledged and coming into government and how they're being distributed. And that was quite taxing, and there was a lot of burnout. So the question of how you're doing and checking up on each other was one of the major issues that we had to address and ensure that we covered, and providing for one another in terms of where we were running out on our stocks, just encouraging each other. We had our WhatsApp platform, then our weekly check-in platform where we would see each other and just vent out and say how we're feeling, just to download and to decompress. And as we were debriefing, we could then assist each other as we could see that some were not coping. Yeah.
Thanks for that, Janet. And back to you, Shireen. I think I said at the beginning when I was introducing you that not only do you serve on governance of boards and in the institutions, but you're also a leadership coach. So you bring a lot of insights into this space. A lot of us in the organizations that we run, we really do aspire to practice a lot more self-care and to show care to the staff that we work with, but we are often falling short. What kind of practical examples can you share on what we can do? And also, what did you pick up from the other organizations? You already earlier gave us an example of what one of the organizations that you serve on the board of that works with the LGBTQ community was able to do for its staff, but also for its wider community. What else have you seen in the space that you would share with us as, I don't want to use the word best practice, but yeah, a good practice.
Yeah, a necessary practice.
A necessary practice. A necessary practice.
Yeah. I think, I mean, I've also used the time during lockdown to listen in on many conversations that one ordinarily wouldn't have an opportunity to participate in. And a lot of these were feminist groups that were working, in women's organizing and things like that around how they were working, feminist funds and so on. And some of what, I heard there was, for example, one organization only worked 4 days a week. So they would give their staff a day off in the week because, this idea of working from home and pretending it's flexible is really a myth. It really places a really unfair burden on women. And so I think that also when we start thinking and saying, okay, no, we will always work from home, it works and so on, we really have to think deeply about what we are saying when we do that. The others were that they used to send their staff care packs every few weeks or so. Because I think there's also this assumption that, yes, you work for us, you earn a salary, so you're fine. And I think Janet has also alluded to that. Sometimes people are in crisis, their families are in crisis, they need support, which is more than the salary you give them, but other material support. And I think there are many organizations who have stepped up on that. And that brings a lot of relief and helps people from a mental well-being point of view to not stress about, am I going to have food on the table? Can I have access to this, that, or the other? The other things that I've seen is that there have been counseling services being made available to staff. There have been organizations who have been having debriefings regularly around this new way of working, the stress of COVID-19, family members who are not well and so on. So I think the thing that COVID-19 has highlighted for us from a self-care point of view is really about mental well-being. And the fact that we so take that for granted, that we just assume, okay, we are, it's an issue. Yes, we just need to survive and carry on. But I think the impact of that over a period of time can really damage a person, to the point where they will struggle to get back to their normal selves. So I think a lot of organizations and people as well have stood up and started talking about mental health and mental well-being. And I think COVID-19 has really opened up space for us to have that open conversation and for organizations to start thinking more actively about how to support employees' well-being in a way that's more than just physical well-being. And then some of the other things that I've seen are I think people asking and reaching out for help, and leaders in particular. So I have seen that there have been some leaders who have felt that they were in crisis and have reached out to their boards, for example, or their board chairpersons and so on, and said, I need help. And that And as a board member also, we were very conscious of what was happening in the environment, and therefore trying to stay connected to the organization more so than we would ordinarily be connected, so that we could respond and act when needed. So I think those are some of the things that I've picked up. I also want to say that I think there's some organizations that didn't do so great as well. I think that there's the inclination of these constant Zoom meetings all the time, the whole day, and then expecting people to still do work and so on. I think that's been, for me, one of the biggest problems with the way things are now. That, because you have access to the technology and we've given you data and so on, you should just be ready to be sitting here on a Zoom call, for the whole day, and then doing your work at night, and then next morning be back on a Zoom call kind of thing. So I think those are some of the things we need to deeply interrogate. And even if we are thinking of this as a way of working going forward, we really need to think about how do we make it work in a way that works for everyone.
Thank you, Shireen. I came alive at the suggestion of a 4-day working week. It was like, we could scrape Mondays. Finally, we can scrape Mondays from the work calendar. But on a more serious note, I actually liked what you were saying about leaning in and asking for support. And one of the questions that I've been asking of my peers is, where does one go for support within the civil society space? One, because we work in a resource constrained environment where you really can't afford to pay for a coach, as a standing arrangement. But also, how can we think about supporting each other within the space? And Janet, this is one question that I'd like to throw to you. You're a leader in the civil society space. You've been doing this work for a very long time. You have a wide community around you. What kind of support have you been getting from fellow leaders, or how have you been lending support as well? Or even a different question, what kind of support do you need so that you can continue to be the great leader that you are and doing the excellent work that you're doing at ZIMCCOD?
Thank you very much, Masego, for that. I think every leader, particularly in crisis times, one of the biggest support that is required is actually the reassuring each other. I think reassurance in terms of, you are doing great. What you are doing is making a difference. And it is one of those key issues that the support that is actually needed, and to ensure that you continue motivated, and it also brings in some bit of care within it. And I think the other issue that I wanted to talk about, and it also includes the donor community and the development partners that we work with, being part of the community that I am in, is the issue of flexibilities in times of crisis, flexibilities in terms of allowing for change in approaches, flexibilities in terms of how are we going to spend, for example. I think we have to take on some bit of empathetic leadership in that regard and support. I think I also was exposed to different kinds of leadership from those around me, from the development partners and the donors that support the work of civil society organizations. I think in as much as this was also new, and our partners were also panicking, not sure exactly of how this crisis was going to unfold, because, the predictions were really scary. They became a point of nagging as well. Are you going to be able to do this? Is this going to be to work? Putting a lot of pressure as well. That was not helping as much, but there were some that were very empathetic to find out. So how are you going to maneuver? How is your staff going to operate? How is your teleworking platform unfolding? Is it well equipped? Where can we come in? We also had partners that were like that. So I think that support of allowing for ideas and connecting and just sitting and having a platform where we can just dialogue, just to hear at the partnership level is very important and is very good support during times of crisis. And yeah, understanding that in as much as things are not going to happen the way they are supposed to, it is good to connect at the partnership level, to connect at the colleague level, and ensure that we remain sane and remain focused in terms of what is it that we can do. So I think empathetic leadership is very important when we are talking about the support system, but also reinventing then the awareness, self-awareness within the crisis is very important. And this is done by the community that we work with. I think we are always raising awareness amongst the citizens for them to know that they have a voice, they have all this, but we haven't reinvented our own awareness to say, who am I and where am I sitting? And what is my support system and where is it that I go? And what is the importance of my work? We haven't done that. And I think that is one of the key support that is also required from the community of practice that we are in. I think that is what I would say for now.
Thank you, Janet. Before I bring you in, Shireen, I just want to read a comment that came through from Tembi. She says, many organizations are under pressure to still deliver even in limited time. This conversation has been a light in the dark. Thank you. Thanks for that feedback, Tembi. Shireen, I'm so enjoying this conversation. One, because it resonates, it's relevant, it's timely, and also because as organizations and as leaders, we still have a lot to learn, and we are learning every day, and really striving to do the best that we can to run, to lead the organizations, lead ourselves, and make a difference in wider society. We're running out of time, but I really didn't want to end this conversation without again tapping into your insights and asking you to, you spoke about mental well-being and the importance of it in this time. And I wouldn't want to leave that conversation at only what needs to be done, but how. What would be your top mental well-being practices that you think leaders in civil society need to consider almost as a daily practice, so that we can show up and show up grounded, show up brave, show up just to do the work that needs to be done?
Thanks for that. This morning I was listening to a podcast which essentially is supposed to be about money, but they were speaking to a guest about habits, about how you change habits to kind of live a different life. And he had been severely overweight, and then he had a young child, and then as he was playing with this young child, he was struggling to breathe and so on. And that created impetus for him to say, well, I have to do something about my weight. I have to change, the way I'm living. But it required much more than kind of fair diet and, all of that kind of stuff. But what he said it was really about, understanding why he needed to change, knowing what he had to do and how he had to do it. And then being able to do it consistently so that you create a habit of a new way. And so for me, it's really about that, because I think we get trapped in this, particularly in civil society. And I might back and tell you stories about that. We get trapped in the cycle of proving ourselves, of working all the time, of we have to do good, we're doing good, we have to work, we can't give up. It's nonstop torture in some ways. And so unless you decide that I'm going to do this, but I'm going to do it differently, you will get into the same pattern that many development sector people get into, and then sit with bad health conditions, later. So for me, some of the things that I have started doing, and what I also tell my coaching clients is critically important, is that you need to first understand what is it that you as an individual need in order to thrive. What is important for you to thrive? So for me, for example, what I have decided to start doing is I have a practice. So my practice is that I journal. I try to journal every morning. Then I read a little bit, whether it's work related or what, and then I do some meditation or something else that just helps me, start my day on a calm note and takes me through the day on a level of energy that I can sustain. But also what I do is, because I have health issues with my back, I make sure that I plan my day in a way that gives me a break in the middle of the day so that I can rest a bit before I take on any other work. I also, for example, and you will probably know that, is I will say that I don't do meetings on certain days because I just feel like I'm not going to be doing screen time all the time because everybody wants to have a meeting. So the person that helps set up my meetings will also be able to say, no, Shireen can only meet on this day and that day. Yeah. So boundaries become critically important in being able to protect and look after yourself. And if you don't uphold those boundaries, no one is going to be worried about it. Everybody is going to feel it's a free for all. So I can call Masego at 10 o'clock at night. I can do whatever I want to. I switch my phone off at 9 o'clock at night. If you call me or whatever, I can't answer. It's my time. So, you really have to make serious decisions about how you want to take care of yourself, how you want to show up in the world, how you want to thrive. And then other things like, depending on your health status and so on, it's also, doing the things that you need to do in order to take care of your health and your well-being, and also those around you, right? Because if they're not in a good state, then you're not in a good state. So, I think it's also about self-care is so much also about, taking care of those around you so that burden doesn't become yours. Because ultimately that's what happens. Last week we had a medical crisis. I was running up and down with my daughter, and at the end of last week I was finished because I was just like, okay, I had to do all of this all by myself, and now I kind of have to find myself again. So I think it's really about it's those things that I feel maybe important. To the boundaries thing, I can't emphasize enough, and really finding a routine that works for you, that can help you start off on a strong note and end off as well. Yeah.
Thank you, Shireen. That finding your routine, finding your rhythm, but also learning to say no. I think, and what you say about setting boundaries is really, really important. Janet, what is your top takeaway, parting short, about how leaders like you can take care of themselves?
I think when you're in a crisis, you have to marshal with care, so lead with care. So the issues of self-care are really important. Surround yourself, I think Shireen has said this, with people that are looking for new ways of doing things. And new ways of doing things means flexibility, means self-care, means work-life balance, and that is very important. And I think leveraging is also very important when we are talking about self-care, leveraging on the different components of the community that is within you. So that's opportunities, that the resources at your disposal, the spaces that are also at your disposal is very important. So I think leveraging is very important, and surrounding yourself and identifying the blind spots. I think in a crisis, you can just decide to go on, and these blind spots will make you bump. And you can literally collapse, and it can get bad. So I think identifying your blind spots and finding the support system is very important and key. And marshalling key is important.
Thank you, Janet. Thank you so much. Last comment of the day is from Nancy, and she says a 4-day working week. Yes, it's a campaign that we must normalize, even if we will still be working 8 days a week. That is what we should aspire to. I couldn't agree more. I'd like to thank the two of you for sharing your insights. And I really like where the conversation went towards the end, because we moved from the abstract of what institutions do, which can easily become faceless. And you took us into your confidence about, the insights and the lessons that you've learned from your own personal experiences. And you really did help us to make this conversation real. Behind our institutions is people. And really, if there's anything that we have learned in this time that we continue to learn is that side of the people management and how we manage ourselves and some of the shortcomings, how to live with our blind spots and how to live with our shortcomings, how to forgive ourselves and step up the following day and try and do the work that needs to be done. I want to end this by reading a quote by Audre Lorde. Caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. So it's not weakness. When we want to pause, take stock of what this has meant for us as leaders. I hope we will continue these conversations with many other leaders in the space. Thank you for joining us today. Goodbye.